Dr. Ivan, it's really good to have you with us today. Could you tell us a little bit about yourself?
Hi, good morning, Father Tim. I'm Dr. Ivan Maldonado. I'm a trauma surgeon at the Marshfield Clinic at the Marshfield Medical Center here in Wisconsin.
Well, I'm very glad to have you and have your expertise. I know that you've been working very hard at Marshfield Hospital System with the COVID unit and just really staying informed. And I appreciate you came with us today to talk to us. But my first question for you is, what must we all be doing during this pandemic? What are the essential things that we should be concerned about during this pandemic to keep ourselves safe?
Well, there are basic considerations that we have to do in any situation that is disruptive to our lives, disruptive to our workload, disruptive to our holidays, and disruptive to be together. And some of them that I just want to mention, number one is be supported. This type of situation that has no predictability whatsoever, it's unknown, it is full of all type of uncertainties. We only have the human nature of supporting each other and to be able to go through that. The second thing is, in this unknown situation, is be careful. We are dealing with a disease that we don't know much about it. It is more that we do not know that we know about it in reality. And we have to be careful. We have to be conscientious about that. We have no cure. That's the reality of it. And we have to protect our families and ourselves in this difficult situation. The third is be alert. I mean, it is very disruptive, again, as I was mentioning before, that we go on with our daily lives. We are very comfortable with our daily routines. We know what to expect from our neighbors. We know what to expect from our jobs. We have travel plans. We have vacation schedules. But now we have to be alert of what is our surroundings. And that will go with the issue of the be too close to the other people that may be infected. So we have to be really careful with protecting ourselves. But amongst all those things that are so disruptive, it comes to the other parts of the human nature that is so necessary. It is to be kind. We are all in this stressful environment. We are all vigilant in one way or the other. But we have to check on our neighbors, check on the people who are close to us, how they are doing. Not if they're sick, how they are handling it, how they are coping with it. We have to enjoy, keep helping people to keep doing what they enjoy, even though it's when they stay at home. And all those two things start to keep the connection, keep the connection within ourselves, our inner selves, and with others, but it's so important. We have to share the information, good information, facts that are verified, that we know are coming from reliable source with each other, because we have to be our own source of information sometimes in the isolation, and we have to be sure that people we love get the right information. If there's anybody affected in our community or our family, have some solidarity, support. They are going through a disease that they have no way to know what's going to happen with them. There is that back in our mind. Are going to survive that? Are going to be doing okay? And share stories of people who have survived, who have went through this, or they are going through this situation, and create that environment that we are together. And the only way that we can be together is doing that, has solidarity and empathy. People who go through this go through a process that we know that is taxing on their whole living, in their bodies and their minds and their souls.
Very good. We appreciate that. And, I think a lot of these things seem like common sense, but it's just good to have a reminder that these are all the things we should be aware of as a must list. But, I notice as a priest, there's a lot of myths out there and a lot of things that people are confused about, and a lot of things people tell me, I'm just like, no, that's not it. And people are so convinced because they saw it on the news or they heard it from someone they trust. Could you share some of the most common myths that you're seeing at Marshfield Hospital these days?
Well, in terms of the myths, it goes with the issue of being informed and be prepared. Be informed. Please check your sources. Check your sources. Where are you getting your information? And that's a very, very important thing. The other issue is be prepared. Because there are going to be so much information out there that you have to deal with. And let me go over a couple of myths. Basic things. The use of the mask. There are so much issues that become regarding the use of masks. And it's important to clarify a couple of things. This is a disease that transmits by little droplets of fluid that come from our mouth or our nose when we sneeze and when we breathe. The size of those droplets is very tiny. We don't even see it, but they travel. They travel, and if you look at any reference, any one of those drops may travel about on average 3 to 6 feet, and they go to the floor. That's why the distance and the use of the mask, because the mask will trap any of those droplets come out of your mouth and will protect others. So, but sometimes there is question: can I do exercise with the mask? Well, if you are in an open place, running around, running or jogging or just walking, you are not close to people. Sometimes using a mask doesn't help you. So don't use the mask in that kind of situation. The other myth regarding the mask is that affects your oxygen and your carbon dioxide goes down, and people say, well, I don't get enough oxygen with that mask. That's such a myth. Healthcare professional, we spend days. I mean, I'm a surgeon. You can be in the OR with a mask 10 or 12 hours doing a case. It has been proven by decades of experience that it won't affect your oxygen or CO2. Sometimes it gets a little uncomfortable, but your oxygen or carbon dioxide, it doesn't go down. And so people have that rumor, oh, my oxygen goes down, I'm gonna suffocate with it. No, they're not. There's no evidence about it, and there's decades and decades of its use. I'm an old surgeon. In the old days, there were no paper masks. There were cloth masks that we used to recycle. And work very well, and now the more modern disposable ones, they do the same job. So that's a couple things about the mask. Transmission, can we spread with our shoes? No, the COVID, we will not be transferred from one place to the other, but with our shoes. It is transferred from one person to the other. That's an important concept. The other thing is that a bacteria or a virus? What is the difference? Well, they're very different. They're very different. And this is an important concept because it goes to the fact of how do you treat it. Bacteria is a different class of small organisms, microorganisms that have a different DNA patterns, and they behave totally different in how they reproduce and they are constituted. So the medications that you use for them are very specific in their class. The same as viruses. Viruses are smaller particles. Okay. Another question that comes around very frequently, is what is this coronavirus or COVID? Is it a bacteria? Is the same as a bacteria? And the reality is no. The bacteria and viruses are totally different in their behavior, totally different in how they are transmitted, very different also in ways on how they are treated. And the way those particles called bacteria or viruses are constituted in terms of proteins are so different. And therefore, the way they are attacked with medication is so different. So antibiotics do not work with viruses. And that's a very important concept because some people will allocate, well, I took some penicillin, I took something at home, I have some antibiotics on an infection that I had, that should be okay. No, it is not. And we have seen that on several patients saying that they had that misconception about the coronavirus. The other thing is myth regard things you drink or eat to avoid coronavirus. And incredible, it could sound very incredible, but some people think that drinking alcohol, ethanol, that we use in our drinks for our parties will protect them. No, it will not. It will not help you. I mean, you're just drinking the alcohol as usually, and the bacteria and the virus wouldn't do any, would be attacked by that one. The other thing is what kind of condiments people use in the food. Is it spicy, a lot of salt, a lot of pepper? No, that doesn't help. And we have to hear that, and that's definitely that sources of that kind of information is really not helping to understand the disease. The third one is the use of any bleach or any disinfectant, that to ingest one of those, or to spray in your eyes and your nose. Some people have even used oil. None of them will help, and especially those chemicals, they are poisonous. If you drink it to a large quantity, it can cause you death, deformities, or non-repairable damage to your eyes if they have contact with your eyes. So that is total misinformation. That is very dangerous, and that will not help with the coronavirus treatment. The other thing that we have to keep in mind in terms of the facts for this virus, a lot of people get infected with the virus, and most of the people survive. The issue that the impact hasn't been so big in terms of the death is that it has infected a lot of people. And that's something to keep in mind. Most people recover, but there will be a percentage of people that will develop severe complications from the virus. So that's something to keep in mind also. Some people have telling us that there are some comments about it's transmitted by the mosquito bites or flies. That's also a myth. It is, again, we go to the basic concept. It is transmitted by our interaction close to each other. That's how this virus goes from person to person. There is no intermediary insect carrying the virus around. Other myths: exposure to sunlight. And one of the other myths that is in terms of exposure to some form of light is exposure to ultraviolet light. Some people mention as well, if I use a black light and ultraviolet light, I will be able to disinfect myself and protect them. No, it's going to cause damage to you. The ultraviolet light is used to disinfect devices, not people. So we cannot use that form of radiation, because light is a form of radiation in ourselves. That is very dangerous. The use of hand dryers in bathrooms, public bathroom, or your home if you have one, do that helps to kill the virus? Nope. That's a myth too. So it is hand washing with soap and water, or an alcohol-based hand sanitizer. That is some of the myths that we have heard, and some of them are very strange to see that it's coming out. But the basic concept with the myth is that undermine the following: the transmission is from person to person. That is the real fact here. All these other myths that put some different concept in our mind, how it goes to person, we have to throw them out of the door. The reality is it goes from person to person. So everything that we can do by cleaning our hands properly with soap and water, hand sanitizer, using the mask, keep our social distancing, that works, because that goes with the transmission of that disease, not the other myths that are floating around.
No, no, doctor, I've heard some people are very afraid to come to church. And I know you're aware of our policies and procedures we're using in the Catholic Church right now. Is it more dangerous to come to church versus like a family barbecue or family get together, or versus going to a bar or restaurant? Is going to a church more risky or less risky in your opinion?
Well, we have spread that information on the Catholic Church, the social distancing, avoid the overcrowding in the facilities of the church, and rigorous disinfection or cleaning after the services. And even I have seen places that during the service there are people cleaning around and keeping it safe. That, compare that to a bar where there is no distancing. Compare that to a bar, barbecue that everybody is talking and close to each other, and there's no processes. The issue with the way that we celebrate the Mass, that we have a process that has proven to be protected. Wear a mask. The distance in between all of us, 6 feet minimal. And the issue of the disinfection, those are things that have proven that we can be in that place safely. But if we are in a bar, there's nobody disinfecting around. There is no social distancing. There's nobody, what I have seen in many places, there's nobody wearing a mask. So your risk is much higher because there's no control. We have an environment that we can control with the ventilation and our processes of cleansing and behavior. Then the likelihood to get infected is much, much lower because we are using proven methods and precautions.
We're very aware that's not zero, which is why we encourage people to use good judgment. But yes, I appreciate your insight in that. So, we've had a couple of videos with Marathon County and Judy Barrows, but could you talk a little bit about how to protect ourselves and others from the spread of COVID-19 in the medical field?
Absolutely. We can talk about that a little bit, and those are things that are very, very, very basic. But I do believe that repetition is the key for all knowledge. I mean, the more we repeat, we'll become more savvy on this. How you protect yourself? First, reduce your chances of being infected or spreading. So, clean your hands. Wash your hands thoroughly, as frequently as necessary. If you feel they're dirty, wash them. If you are going to be handle food, wash it. If you go in contact with surfaces that you think that may be infected, wash your hands. Soap and water, hand sanitizer. Maintain your distance. Be mindful of the distance. Also, avoid going to crowded places. Again, it is an issue of changing of behavior. If you go to a crowded places that they are not following the processes, you're pretty sure you're going to get exposed. So you are a more highly likelihood of getting infected. Avoid, and this is well into connection with washing your hands. Avoid touching your face, your nose, the mucosa, as we call it, the oral mucosa of your eyes. Do the droplets that we mentioned at the beginning of this video, they will go get into your hands, and from your hands go to the mucosa, and the mucosa, they enter your body. So you just want to keep your hand washed, but don't touch your face. And if you have to do it, be sure you wash your hands thoroughly before you do that, and you wash your face with soap and water. Again, respiratory hygiene. If you cough, use a Kleenex, a disposable handkerchief. Use your arm and move your elbow to the front this way, just to contain the dispersion of the droplets that we talked, because all those maneuvers protect others. And this goes to the fact of the issues that we discussed at the beginning, the empathy and the support. You are doing all those things for others. Keep that in mind. Every time you cough and you sneeze, and you have to cover your face, Immediately, hand sanitizer, wash your hands again. This change of behavior. You develop any symptoms, contact with you. Well, absolutely, you have to isolate yourself and contact your health providers in order to get tested. You are at home and you already have symptoms and you develop respiratory problems, call 911 for help.
Very good, thank you. Now, I know we got a number of people in town who have COVID-19. What are ways that we can, as caregivers, but also people who might be ill with COVID-19 at home, what are some basic things we can do to help alleviate the symptoms and keep everybody safe?
Well, in terms of the symptoms, of the fever and other symptoms like pain, you can follow what your primary care provider physician will order you. Acetaminophen, Tylenol will do that. Will keep your fever down. This is mostly symptomatic treatment. But in terms of the people who are COVID positive at home, first let's talk about the caretakers. First, if it is possible to help with the caretakers, have that person to be in an isolated room, a separate room from the others. That will help with the distancing. If they have an extra bathroom, so they will be the only using the bathroom facility, that will be ideal. In some situations, you cannot do that, and then follows the process of sanitizing those facilities after the COVID-infected person uses that. So that's the first step. It is arranging the way your home in terms of optimize the distancing. The second thing when you have somebody with a COVID-19 at home is use the mask when do you take care of them. Wash your hands always before and after, or managing with all their care. Some of the precautions that have to be taken care of, and it's not when we focus on the respiratory. If somebody is convalescent at home and in bed, and sometimes there are bodily necessities that like defecation or so forth occur in bed, be sure that you handle those with more significant precaution. Separate all those linens from the patient and from everybody. Wash them when hot water in your dishwasher with soap. And I mentioned that because the coronavirus has two main manifestations that we have seen in the medical world. Is there are patients that are mostly respiratory, and there's another group of patients that develop gastrointestinal problems like severe diarrhea. And in the initial studies that were done in China, the detection of the virus in feces and excrement, they were as high as from respiratory secretion. So in a way, if you have somebody at home like that, ideally, their bathroom facility will be separated from other people and the strict sanitation occur. Second, these patients, these people need good hydration. Hydration is a must always in all these kind of diseases, and also good nutrition. Meaning good nutrition is good protein sources and good fiber and vitamin sources. If you don't have access to fruits, vitamins, supplements will do. Vitamins are important. Especially those supplements contain electrolytes that are necessary for the body to heal, vitamin C and so forth. So those things are really important for caring somebody at home. In terms of making comfortable, if that person develops any respiratory problems, immediately call 911 because that is a sign that the disease may be getting into a very complicated phase, and the care will be necessary to be rendered in the hospital. The behavior of the caregivers is crucial. I mean, and this is something that we have to stress is and dealing with COVID patient at home. Everybody has to be watching for each other. You develop symptoms of fever, weaknesses, gastrointestinal symptoms. People who develop loss of sense of smell have been reported, a classic of this virus, that you may be talking and being doing okay, no fever, no nothing, but you lose the sense of smell, meaning that you cannot distinguish the others. Get yourself checked because this virus manifests that way. Uh, After checking on each other, then the issue, if we have only one person being the caregiver for the COVID patient, then that person should just keep all the utensil, plates, vases, and everything that this person uses separate from everybody else. Wash them separately, again, soap and water. Whoever prepares the food for this person also a strict hand hygiene and all those precautions, and separately clean all those utensils and plates and so forth. So if you think about it and you listen to this conversation that we're having, it's an issue of behavior. That's a change of behavior. You have somebody with that disease at home. We have to be vigilant for his complication, and if somebody else developed, we have to be vigilant regarding their hygiene and be sure that all for his personal items are washed separately. You don't need any special soap or anything like that. You can use your regular soap at home, and everybody else keeping washing their hands and every time they approach this patient with a mask is necessary. I hope that helps to have everybody in their mind that everybody, if you have one person to take care of this individual, will be better because then that person will develop a routine with the patient, and the routine is the food preparation, the hygiene, and the care of the personal belongings of this individual has to be almost like a ritual. You have, if things don't look that can be handled with a bare hand, if you have gloves at home, that would be advisable to use gloves with your hand on the linens before they go to the washer, and don't throw that away. So it is that concept that we have to have. If all the functions that are holding the care of the COVID-19 patient has to be shared, everybody has to follow the same rules. There are no shortcuts here, not cutting corners. Always the precautions, always the precaution. Washing your hands before, washing your hands after. Keep your mask on when you're helping this person, and uh, be careful with all the surfaces that this individual touches because again, you have to sanitize all of them also. So it's a ritual of cleanliness and process.
Well, thank you very much. We've been talking, ourselves for over a month now about all these things. And over this past month, are you more or less worried about the COVID-19 virus in the Abbotsford area? Are you more hopeful that we're not going to have it in a big way, or are you thinking that we should really be prepared?
From my point of view, we should be prepared. I mean, we haven't seen the last of it. Human interaction to finish goals, no cure it. I mean, it's inevitable. The virus is moving from one person to another. We are interacting more. There have been more interaction in public places that definitely will expose people to get infected. So as a healthcare professional, I have to tell you that at this point, I have to be more vigilant than ever that patients that are going to be receiving will be infected with the virus. And also, there could be a lot of people who are symptomatic in our community without the virus because as the majority of people are. They get infected, but they are completely asymptomatic. So definitely preparation has to continue, education has to continue, awareness has to continue. We have to be vigilant, be careful, we protect ourselves and others. That cannot stop. We haven't seen the last of this. And always keep in the mind the following: we do not have a cure. As a physician, I cannot do anything for you but to support your care in the hospital, keeping nutrition, avoid complications, keeping you well hydrated, all the symptoms controlled. But we can alleviate a lot of the pain. We can alleviate all of the symptoms. We cannot cure it. And that is a reality. It's hard to talk about such things. We are in a society of instantaneous solutions because we have an instantaneous world. We have an internet where everything is instantaneous. Everything is fast. Biology systems, bacteria, they're not instantaneous solution for the problems. It takes years of research. It takes a lot of energy to find a cure. And since we don't have a cure, we don't have a magic pill or to take care of this disease, we have to change our thoughts. We have to change our behavior at all levels in order to keep everybody safe and go through this.
Well, thank you so much for joining us today. We really appreciate your time, and we appreciate all the good work you're doing for our community through Marshfield Hospital. So God bless you very much, and we hope to be in touch with you as we continue to move on with all of these things. So thank you so much.
Thank you for having me.